Recent data from the U.S. Preventive Services Task Force reveals something troubling, something urgent. In just a few years, overdiagnosis and overtreatment in Americans over 70 have risen more than 30%, and experts now call it a silent crisis. These tests, ordered in the name of safety, are often doing the opposite. They are adding stress, adding fear, and in many cases, quietly reducing the quality of the years you still have ahead. Many seniors believe more testing means better protection. But the truth, the part rarely spoken, is that some tests after 70 offer almost no benefit, yet carry very real risks. As a doctor, and as someone who has walked beside thousands of older Americans, I have seen how easily you can be pushed toward procedures that bring worry instead of comfort, confusion instead of clarity, pressure instead of peace. Before we go any further, let me ask you 3 simple, honest questions, and I want you to think about them carefully. Have you ever said yes to a test without truly knowing why it was ordered? Have you ever held on to anxiety because no one clearly explained a result? Do you ever feel that the older you become, the more the medical system pushes, instead of understanding what you truly need? If any of this feels familiar, stay with me. Because later in this video, I will share something most doctors never say aloud. Something that might change the way you protect your health from this moment forward. And if this already speaks to you, take a moment to like, subscribe, and stay connected with Senior Vitality Path. We are here to guide you with honesty, compassion, and real understanding. Now, let us move into the heart of our conversation and uncover the 5 medical tests every American over 70 should think carefully about before agreeing to them. 1. PSA screening. Across the United States, many doctors still order PSA tests for older men, simply because it is the routine. But recent data from the National Cancer Institute shows a troubling pattern. Most prostate cancers found through PSA screening in later life grow extremely slowly, so slowly that they never become dangerous. The test often leads to a chain of follow-up procedures that create far more harm than benefit. A slightly elevated PSA number can result in a biopsy, and that biopsy carries real risks. Infection that requires hospitalization, bleeding that takes time to recover, and treatments that may leave a man dealing with urinary leakage or loss of sexual function. These are not small changes. These are daily challenges that affect dignity, confidence, and independence. And in many cases, the treatment does not extend life at all. Many seniors tell me they feel pressured to agree to testing, because they believe saying yes proves they are taking care of their health. But sometimes the bravest choice is asking one more question. Do you ever feel caught in that same situation, wanting to trust your doctor yet feeling unsure inside? The deeper issue comes from a system built on fear of missing a diagnosis, and the old belief that early detection is always best. But modern evidence shows that when a cancer grows slowly, and a person has other health concerns, aggressive treatment often adds burden, not years. The solution begins with 3 simple questions that every senior has the right to ask. What is my realistic life expectancy? Would this cancer affect my health within the next 10 years? And if I choose a biopsy, what risks am I taking? These questions restore control, protect quality of life, and bring the focus back to what truly matters: your comfort, your clarity, your long-term well-being. 2. Colonoscopy after advanced age. Across the country, many doctors continue recommending colonoscopies, even when a patient has already had normal results in the past. It happens because the system follows old routines, even when modern data tells us the benefit drops sharply with age. Research from the American College of Physicians shows that complication rates rise 3 to 4 times in older adults, while the chance of finding a cancer that truly impacts long-term health becomes very small. The risks are not rare. A colonoscopy can lead to a perforation of the colon, heavy bleeding, dangerous reactions to anesthesia, and emergency hospitalization. These are real events that can turn a simple day of screening into weeks of recovery. Many people tell me they feel torn between wanting to be safe and fearing unnecessary procedures. Have you ever felt that same tension inside, wanting to do the right thing, but unsure which choice actually protects you? The deeper problem is not neglect. It is the weight of old hospital policies, the fear of changing guidelines, and the belief that more testing must always be better. But science paints a different picture. When the risk of harm grows faster than the chance of benefit, continuing the same test becomes more harmful than helpful. There is a better path. Every senior can ask their doctor a few key questions. What is my real risk of colon cancer based on my health today? When was my last colonoscopy, and what were the results? And is there a safer alternative, like a stool-based test, that can give me reassurance without the same level of risk? These questions help you make decisions rooted in your values, your safety, and your quality of life. 3. Mammogram after advanced age. Across the United States, many older women are still called back for routine mammograms, even when past screenings have been completely normal. It happens because old guidelines remain in place. Insurance systems encourage frequent testing, and families often push for more exams out of fear. But modern research tells a different story. According to recent findings in JAMA Internal Medicine, many breast cancers detected at this stage grow so slowly that they never affect a woman's lifespan. The real risk is not missing a dangerous tumor. The real risk is what happens after a false positive. Anxiety that keeps you awake at night. Extra scans and biopsies that feel overwhelming. Treatments that can damage the heart, weaken the immune system, and create months of fatigue. Radiation and chemotherapy can bring side effects that follow you long after the treatment ends, reducing the quality of life you have worked so hard to protect. Many women tell me they feel torn between doing what seems responsible and protecting their peace. Have you ever felt that same conflict, wondering whether another test will help you or simply add one more worry to your life? The deeper issue is that our medical system still leans on older rules and the belief that more screening must equal better care. But science shows that when a cancer is slow growing, treatment does not add years. It only adds stress, discomfort, and emotional weight. There is a better approach. Ask your doctor 2 important questions. If a lump is found, would treatment truly extend my life? And how fast or slow is this type of cancer likely to grow? These questions shift the focus back to what matters most: your well-being, your clarity, and the daily comfort you deserve. 4. Overtight blood sugar control. Across the country, many doctors still push for very low HbA1c targets, often aiming for numbers under 7. This approach works well for younger adults, but it can create real danger for older patients. Recent reports from the American Diabetes Association show that overly aggressive blood sugar control greatly increases the risk of severe hypoglycemia. And hypoglycemia is not just a number on a chart. It is the dizziness that makes you fall. The confusion that steals your balance. The sudden drop that can lead to a broken hip, an emergency room visit, or in the worst cases, a life-threatening event. The truth is that a slightly higher blood sugar range can be much safer. The ADA now recommends targets between 7.5 and 8.5 for many older adults, because this range reduces hospital visits and lowers the risk of dangerous lows. Many seniors tell me they have felt pressured to chase perfect numbers, even when those numbers made them feel weak or shaky. Have you ever had that moment when your blood sugar dropped, and you knew something was not right? The deeper issue comes from doctors applying guidelines designed for younger bodies. It also comes from the habit of believing tighter control is always better. But science tells us that the body changes with time, and the treatment plan must change with it. There is a clear path forward. Start by asking your doctor 2 simple questions. What HbA1c target is truly safe for me? And based on my health today, am I at risk for low blood sugar? These questions help shift the focus from perfect numbers to real well-being. From pressure to balance. From fear to confidence in your daily life. 5 unnecessary CT and PET scans. Across the United States, many older adults are sent for full-body scans, simply to be sure nothing dangerous is hiding. It sounds reassuring, but modern research shows that this approach often causes more harm than good. Studies from major cancer centers reveal that most findings on these scans are incidental. Small spots or shadows that do not affect lifespan, yet trigger a long chain of follow-up procedures. The risks are real. CT and PET scans expose the body to significant radiation. Once a small abnormality is found, many patients are then pushed toward biopsies or invasive tests, and those procedures can lead to infection, bleeding, or treatments that offer no real benefit. I remember one woman from Arizona who went in for a scan just to feel safe. They found a tiny lung nodule that never changed over time. But before she knew it, she had gone through 2 biopsies, weeks of worry, and a hospital stay from a bleeding complication. She later told me the fear was worse than the finding itself. Have you ever been through something that felt like more stress than clarity? The deeper issue comes from 3 powerful forces: patient anxiety, doctors wanting legal protection, and long-standing habits that assume more scanning must mean better care. But the evidence says otherwise. When a test does not improve survival and increases fear, it stops being a tool for health and becomes a source of harm. There is a better and safer approach. Before agreeing to a scan, ask your doctor 2 important questions. What symptom or concern makes this scan necessary? And if the scan finds something small, what will we actually do with that information? These questions guide the conversation back to what truly matters: your peace of mind, your safety, and your long-term well-being. As we close this conversation, I want you to take one message with you. Not every medical test is meant for every stage of life. What truly matters now is your comfort, your clarity, and your quality of living. You have the right to pause, to ask questions, and to choose the kind of care that protects your peace rather than disrupts it. You are not meant to be swept along by a system that treats everyone the same. You deserve choices that honor your experience, your values, and your future. Whenever a doctor recommends a test, remember the 3 golden questions. What is my real life expectancy at this point in my health? If this test finds something, will the treatment actually extend my life? And what are the risks of the test itself? These questions are powerful. They shift the conversation back to you. They remind your doctor that your well-being is more than a number on a chart. It is your independence, your comfort, your days with family, your mornings without fear. The truth is simple. The right test at the right time for the right person can protect years of your life. But the wrong test can steal those years quietly. And that is why taking control is not just smart. It is essential. Now I want to hear from you. Your voice matters in this community. Share your story in the comments. Have you ever felt pressured into a test you were unsure about? Or, have you ever asked a question that changed the direction of your care? Tell us your age and your state, so we can support you with advice tailored to your life here in America. And if this message speaks to you, take a moment to like this video and subscribe to Senior Vitality Path. We are here to walk beside you, to protect your health, and to help you make choices that honor the years ahead.